Obesity is actually measured in terms of body mass index, and body mass index is calculated as your weight in kilograms divided by your height in meters squared. However, I've done a translation for you to help because although you might find this frightening, I think it's useful information that we need to know. So if you're 5'2", your weight shouldn't be above 136 pounds. At 5'4", it's 145. At 5'6", it's 155. At 5'8", it's 164 pounds. 5'10", it's 174 pounds. At 6 foot, it's 184 pounds. And at 6'2", I would wish that, it's 194 pounds. I think corporate responsibilities for health are huge. Employers control so many aspects, either directly or indirectly, of their employees' lives that health should always be at the forefront of their planning because a healthy workforce is one that is more productive and will be more productive through their entire working cycle. So it's a really important aspect. I think Cayman has been lagging in that regard. For example, in many countries, there is a branch of medicine called occupational health. And that is something which I think could really be developed here so that you actually have healthcare workers embedded within an organization who understand how that organization works and how, in order to affect change for the benefit of the health of that organization. But I'm very supportive of any move to improve the health of the workforce, although that clearly is a little bit outside of my remit. I certainly, as everybody knows who lives around South Sound, South Church Street, I'm out there every morning and every evening making sure that I can stay as healthy as I can because I know that I'm going to live longer and I'm going to have less disease as a result of it. So many non-communicable diseases are related to the state of your health, and if you can improve that, then you will have a big impact in your enjoyment of life. One study has shown that people with a body mass index, a BMI, of between 35 and 40 their risk of death from COVID increases by 40%, which is a worryingly high level. So we need to pay attention, if we can, to try to tackle issues of being overweight wherever we find them. I really recognize that obesity is a multifactorial issue. I also think the word is not very nice. It's not a very friendly word. If you think of a word like rose, then you think of a word like obesity, it's not a very attractive word. And it's one that I often refrain from using because it has so many social connotations that are associated with it, but I do recognize it's very multifactorial. There may be reasons around access to the right sorts of food for one reason or another. It may be reasons around habits that have been ingrained from a long period of time. There may be mental health issues around why people find themselves in one situation rather than another. And even if you've been in a situation for a very long time, as I was when I was a smoker, I have had periods in my life when I have been far more weighty than I should be. It's really difficult to get out of those positions. You need a lot of willpower and strength and a lot of help from people. Just saying lose weight is not helpful. You really need to get a lot of support from all sorts of different quarters in order to do that. As far as what governments can do, we have been looking around the world at what different governments have done. And so they've done things like had much better labeling on food, requiring labeling on all foods. Taxes on certain types of food or sugar-sweetened beverages. In Bermuda, for example, they increased the tax on sugar-sweetened beverages hugely, and they found that the sales of bottled water went up a great deal, which is good news apart from the plastic waste. But So you can really change things sometimes by legislation. You can help education establishments by changing the sorts of food that are provided, and, perish the thought, considering where you allow fast food restaurants to be. In other words, don't allow them outside the doors of your schools. There are all sorts of different things. One thing that the government is doing is to introduce a program which has actually already started. Some of you may have seen the advertisements, called What's Your Move? And it's something that we're going to be running over the year. It's very Cayman focused, because not everybody can go out and run or walk, but they may be able to move, which is why we've been careful about the words that we've chosen. At home, some people can do upper limb exercises in order to get your blood pumping around and becoming a little bit more fit. So it's all about trying to introduce more movement into your life. If you can, 20 minutes or 30 minutes, perhaps split into two. But we're going to be running that over the next year, and you're going to get bite-sized pieces of information about that initiative. We also have an email address. In order, if you have any great pictures about people getting moving, please do send them in, because we'd love to use them. That email address is publichealthdepartment@hsa.ky, and when you use department, it's DEPT, so publichealthdept@hsa.ky. Do send us your photos, that would be great. We're hoping that we're going to be able to bring you this segment every week, so please do watch weekly to this. And if you wanted to follow me, please do follow on Twitter @CMO Cayman. What's Your Move also has a web address, so do please have a look there. That's going to be launched shortly at whatsyourmove.ky.